Okay, so today I'm going to present post-operative care of case general trauma of the head, chest, and abdomen. So the patient undergoing surgery, Wong Yung Kyong, undergoing laparotomy for hemoperitoneum, and uh, during the surgery, the patient we calculated the patient fluid loss, which is 2 liters. Patient lost 2,000 milliliter of fluid. So for this patient, we need to emphasize for the post-operative care, his blood loss, control of diuresis, and also for control of coagulation, because the patient is in bed rest for 7 days. And after completed surgery at 12, we took the vital signs, the pulse, respiration, respiratory rate, blood pressure, and temperature. So the patient pulse is 106, respiratory rate is 22, with blood pressure of 125. And his consciousness is 9, and his temperature is 36.5. So from here we can see that he has elevated blood pressure of 125. And after few hours, his blood pressure has dropped almost 520, indicating that surgery is successful and the patient is recovering. Okay, so patient is in need of intravenous access, yes. So and then he is needs compression stocking because patient is bedridden, and this is for prevention of thromboembolic complications. And patient has hemovac wound drains. And for the urine observation, the color is transparent, there's no presence of stone, no presence of blood, and we put a Foley catheter to calculate the urine output and for the control of diuresis. And now we look at the first day, the post-operative first day. So the patient has complaints after surgery, patient pain on the post-operative scar, has pale skin, and has severe general condition. The skin is pale and the pulse is 76, satisfactory feeling and tension, with symmetrical blood pressure of 125/90. Temperature is around 36. Tongue clean and moist. So for the local status, the dressing is moderately wet with serous hemorrhaging discharge of 20 milliliters is drained. So and then the stitches are looked and under the bandage are well developed without signs of inflammation. And for the post-operative fluid care, for the first day, so we know that the patient lost 2 liters of fluid, and uh, we need to correct this balance. So we give infusion therapy of crystal normal saline crystal for 1 liter for 6 hours, and albumin 800, and clear fluids 1.2 liters, and lactated ringer solution 600 milliliters. And we calculated the fluid output also, and there is also the fluid from the hemovac. And this continues from day 2, 3, 4, and 5, and 6. And at day 7, we based on the vital signs, we see that the patient at vital sign is improving. So we lessen the fluid intake. So normal saline 800, albumin 600 milliliters, for lactated ringers 400 milliliter, and also calculate the total fluid output. So in total, the fluid intake is 9.6 liters. The total fluid output is 7.6 liters. So in total, we achieved a positive balance. So the patient's fluid loss has been corrected. And for the post-medical chart, for 3 days, we give him ibuprofen. Uh, is injected intramuscularly for 3 days, and this is given to alleviate the pain. And then next, we give him fluxiparin subcutaneously on the abdominal region for 5 days, 1 times a day. This is Uh, Flexiparin is anticoagulant, so this is used for prevention of thromboembolic complication. And next is ceftriaxone, 2 grams injected intramuscularly for one time a day for 7 days. So this is for antibiotic therapy. And on the 7th day, the general condition is now satisfactory. His blood pressure is now normal, and his temperature also normal. Everything, and then his local status: the dressing is dry, drainage removed, and the stitches under the bandage are well developed without signs of inflammation. Another thing to note is that we also change his dressing every day. And that is it for me. Thank you.